Alright, I'm providing privacy and performing hand hygiene. Hello, my name is Alina. I'll be a nurse today. How are you doing? Patient states they are doing fine. Okay, so today we're going to do a head to toe assessment. It should take no more than 20 minutes just to get an overall view of your health. Is that okay? Patient states that it's okay. Alright. So I just want to start off with the two identifiers. So can you tell me your correct name and date of birth? All right, and as I'm looking at the name bracelet, the patient states the correct name and date of birth. All right, do you have any allergies or any pain at this time? Patient states they have no allergies. And then can you rate your pain from 0 to 10, with 10 being the worst pain in your life and 0 being no pain? Patient says they have no pain, so they say it's 0. All right, so I have a couple of questions for you. They may seem silly, but they are appropriate to the situation. Can you tell me the current president? Patient says Donald Trump. Okay, can you tell me what year we're in? They say 2020. All right, and where are we? He said my home. And why are we here? All right, and the patient says for head to toe assessment. All right, so ask those 4 questions. The patient is ANO times 4, no signs of acute distress. The patient's facial expression and mood is appropriate to the situation, and the speech is clear. All right, so now I'm going to start off with inspecting the skin. So as I'm looking at the patient's skin, it is appropriate to race. I don't see any lesions, wounds, incisions, or bruises at this time, so that is good. And I'm going to use the back part of my hand. So I'm going to touch the upper extremity and the lower extremity. All right, and the patient's skin is warm and dry to the touch. All right, and so now I'm going to inspect the nail bed. So if you can hold your hands out. Okay, and as I'm looking at the nail beds, they are pink, so that is normal. And so now I'm going to check the capillary refill. And as I'm looking at the capillary refill, it's coming back within 2 seconds, so that is normal. All right, and can you do the diamond symbol for me? And the patient does the correct diamond symbol, so it shows no signs of clubbing. Okay, and so now I'm going to inspect the head. Is that okay? Patient says it is fine. So as I'm looking at the patient hair, it is blonde, short, and straight. I don't see any lesions or infestations, so that is normal. All right, and so now I'm going to inspect the cranial nerve 5. So can you clench your teeth for me? Okay, good, thank you. All right, and so now I'm going to have you to close your eyes, and I'm going to use a cotton swab, and then I'm going to touch your face with it. So every time you feel it, just say now. Now, 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 now. Okay, the patient says now every time I touch their face, so it is correct. So the cranial nerve 5 is intact. All right, and so now we're going to inspect cranial nerve 7. So can you smile for me? Okay, frown. Puff up your cheeks. Okay, it shows that the patient's face is symmetrical, so cranial nerve 7 is intact as well. All right, and can you do cranial nerve 11? So can you shrug your shoulders? All right, both shoulders are symmetrical. Okay, and can you push your face against my hand? Good. And we're gonna do the other side. Good. Okay, so the patient's shoulders is symmetrical, and the patient showed facial head resistance. So cranial nerve 11 is intact. So now we're going to go down to the eyes. I don't see any redness or drainage or dryness. The patient's conjunctiva is pink and moist, and the sclera is white. Okay, and so now I'm going to use my pen light. All right, so just look straight ahead for me. Good. Good. Okay, looking at my pen light, the patient pupils is 4 millimeters, so that is normal. All right, and so now I'm just going to have you have your head straight and just follow the pen light with your eyes. So I'm going to use the 6 cardinal gaze. And then in this test, I am testing cranial nerves 3, 4, and 6. And I am looking for apoptosis, nystagmus, and strabismus. And I don't know any at this time. All right, keep your head straight, follow the pen light. All right, and good. So the patient's pupils is round. The patient's pupils is even, round, reacting to light, and passes the accommodation test. and it's 4 millimeters, so that is normal. And the cranial nerves 3, 4, and 6 are intact. Okay, and so now I'm going to inspect the ears. So as I'm looking at the ears, I see no signs of drainage. All right, and so now I'm going to test cranial nerve 8, and so I'm just going to do the whisper test. So I just whisper 2 words to you in each ear, and you just say the correct words. Okay. Patient says the correct words. All right, and patient says the correct words. So cranial nerve 8 is intact. Okay, so now we're going to go down to the nose. So if you can look up for me. And I'm looking in the nose, and the patient nose is symmetrical. I don't see any asymmetry, any disformities, or inflammation. So now we're going to check the nose patency. So just hold one nostril and breathe out the other nose. Okay, can you do the other one for me? All right, and the patency is bilateral, and I don't note any drainage. All right, so now we're going to look at the lips, gums, and tongue. So just say "ah" for me with your tongue out. Okay, the lips, gums, and tongue is pink and moist. All right, and just say "ah" for me. All right, the uvula and the soft palate rises, so that is normal. All right, so now we're going to test cranial nerves. And that was test of cranial nerves 9, 10, and 11, and they are all intact. Okay, and for 12, I'm sorry, cranial nerves 10, 9, 10, and 12 are intact. And so for cranial nerve 12, I just want you to say light, tight, and dynamite. And a patient says it correctly, so cranial nerve 12 is intact. Okay, so I'm looking at the accessory muscles. Their patient is not using any accessory muscles. Okay, so now I'm going to auscultate your breath sounds. I would do this on bare skin, so just take deep breaths every time I press the stethoscope to your skin, okay? All right, right upper lobe, left upper lobe, right middle lobe, I don't know if you can see it, left lower lobe, right lower lobe, and left lower lobe. Good, okay, so now we're going to check the posterior, so sit up for me. All right, again, this is on bare skin. So right upper lobe, left upper lobe, right middle lobe, left lower lobe, right lower lobe, and left lower lobe. Okay, good. Patient's breath sounds is clear, and I don't hear any adventitious sounds, so that is normal. And so now we're going to test the cardiac portion of this test. So I'm just going to check the carotid pulses. Okay, good. Good. All right, the carotid pulse is +2 bilaterally. All right, and so I'm just going to have you lay back in a 45-degree angle. So the patient does that, and then turn your head to the right. All right, I don't note any JVD or edema. Okay, you can sit back up. Okay. All right, and so now I'm going to auscultate the heart sounds. So I'm going to start off with my diaphragm. So I'm going to do aortic. Again, this is on bare skin. Aortic, pulmonary, Erb's point, tricuspid, and mitral. Okay. And now we're going to do it with the bell. Again, on bare skin, aortic, pulmonary, Erb's point, tricuspid, and mitral. Okay, good. S1 and S2 is noted, and I don't hear any extra sounds or any heart murmurs, so that is normal. So I'm just going to palpate your radial pulses. So I'm going to do this side first. Okay, good. And then do the other side. Okay, good. Both radial pulses are +2 bilaterally. So now I'm going to check the lower extremity. So I'm going to do the dorsalis pulses, dorsalis pedis pulses. So I'm going to do this. Okay, they are +2 bilaterally, and I'm going to check the posterior tibial pulses. All right, and they are +2 bilaterally. Okay, and so now I'm going to have the patient lay back, and I'm going to check the symmetry of the abdomen. So the abdomen is symmetrical and the abdomen is flat, so the contour is flat, so that is good. So now I'm going to, oh my God, I'm going to auscultate the quadrants. Again, this is on bare skin. Right lower quadrant, right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Okay, good. The vowel sounds are active. All right, and now I'm going to palpate your quadrants. So, right lower quadrant, right upper quadrant, left upper quadrant, and right lower quadrant. Okay, I don't know any tenderness or distinction, so that is normal. So now I'm going to check for the extremities. So I'm going to check the elbows, knees, wrists, and ankles. So for your elbows, can you extend your arms out? Can you flex your, and flex your arms? Okay, and then we're going to have our palms facing down, so pronation, and then supination. Good. And for your wrists, can you extend, flex, and hyperflex? Good. Okay, and so the upper extremities are intact, so we're gonna go down to the lower extremities. So for the knees, can you bend the knees for me? Can you flex them and extend? Okay, and the patient flexed the knees and bent them so they are symmetrical and even. Okay, and for the ankles, can you inversion, exversion, plantar flex, and dorsiflex. Okay. So everything is symmetrical and everything is normal for that, and the contour is appropriate. So where I'm going to do the sharp dull test. So you just let me know if you feel any sharpness or dullness. I'm going to start off with the upper extremity. Patient stated correctly, 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 correct. All right, and we're going to do the lower extremity. Correct, 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 and correct. All right, so the sensations are equal. All right, and so now I'm going to check the strength. So the muscle strength. So if you can push away from my arms, good, and then pull back on my arms, good. And then the lower extremities, push away, push your knees away, push away from my arms, my hands, and then pull back on my hands. All right, good. So the muscle strength is +5 and it is normal. All right, and so the last part is the gait. So if you can get up for me and then walk, take 4 steps forward and then 4 steps back. The patient takes 4 steps forward and 4 steps back. And the gait is normal and even. All right, do you have any pain? Patient states they have no pain from 0 to 10. Patient says it is 0. Okay, can I get anything for you, anything to drink or anything? Patient says no, they're fine. All right, so I just want to thank you for your time. So at this time, I will lower the bed, lock the bed, and then bring up the bed rails, bring the call light if you need me for anything. And I want to thank you for your time. Hand hygiene.